Tension rise in Ilemosho, Ekiti as gunmen kidnap monarch. Kano confirms 10 persons dead, 400 hospitalized after drinking poisonous fruit juice. In international news, U.S. slams Russia with sanctions over cyber attacks and its infiltration of 2016 U.S. elections. In the sport, Ministry of Sport says no COVID-19 case was recorded at the sports festival.
This is ANN News.
I am Olajumoke Olatunji, resident of Ilemosho, Ekiti, in Oye local government area of Ekiti State, are in a state of turmoil, confusion, and fear over the adoption of the community's monarch, the Obadu of Ilemosho, Oba David Adegboyega. Members of the community say gunmen laid siege on the palace along Ishon Ekiti around 8 p.m. after the last visitors had left the palace. This is happening exactly 8 days after Elewu of Ewu Ekiti, Obade Tutu Ajayi, escaped an attempted kidnap. Ilemosho Ekiti chiefs say the kidnappers gained access into the palace by going through a fence, after which they fired shots into the air and whisked away Oba Adegboyega. Ekiti Police Command spokesman ASP Sunday Abutu described the situation as unfortunate and regrettable. Abutu said the State Commissioner of Police Tunde Mobayo has ordered a manhunt for the kidnappers. Kano State government has confirmed the deaths of 10 persons after drinking poisonous fruit juice. 400 others are presently hospitalized. A similar incident of poisonous fruit juice last month claimed 3 lives and got more than 100 hospitalized. Kano State Commissioner for Health, Dr. Aminu Sanyawa, stated in a video recording on Thursday that of the 400 persons hospitalized, 50 were undergoing treatment for kidney-related ailments. Sanyawa says the outbreak has spread to 13 local government areas of the state. The commissioner has urged residents to be vigilant when consuming any fruit juice during this Ramadan period to avoid catastrophic consequences. Nigeria Center for Disease Control has reported no COVID-19 deaths in the past 3 days, but it recorded 80 new cases in 12 states on Thursday, which it says raised the total tally of the virus in the country to 164,080. Since the virus was first detected in the country, 2,061 patients have died of complications from the disease. And CDC says only 3 deaths have been reported from the disease in Nigeria in the past 2 weeks. Once again, Lagos reported the largest share of the new cases with 29 infected persons. Rivers, Zamfara, Akwa Ibom, Edo State, Osun Plateau, Ogun, Kano, Nasarawa, FCT, Oyo all recorded cases in single digits. The federal government says it has stopped the COVID-19 vaccination programs because it is not sure when the next batch of the AstraZeneca vaccine would arrive. Minister of State for Health, Senator Olorunibe Mamora, gave the explanation at Tuesday's media briefing of the Presidential Task Force on COVID-19 in Abuja. As correspondent to Kelechi Mekalan report, it is also to enable those who had received their first jab to have enough vaccine doses to complete their shots.
We believe that in a situation where we still cannot specifically determine when the next batch of AstraZeneca vaccines will arrive, then I think wisdom only dictates that it's better for us to vaccinate people fully, and so that we can say that we have a pool of citizens that have been fully vaccinated, since this vaccination comes in 2 doses.
Nigerian health authorities announcing plans to halt the COVID-19 vaccination program. The country rolled out its mass vaccination campaign in March after receiving 3.94 million doses of the Oxford AstraZeneca vaccine. That's just enough to vaccinate less than 2% of its over 200 million population. But a high global demand for the vaccines has led to delays in the supply of the jabs.
Second delivery of this AstraZeneca vaccine is not very is not confirmed yet as we expected, because we are expecting that before June or by June we should have the second delivery. You know, the third phase in quotes in Europe and Americas and UK, you know, is making the demand. In India itself is making the demand for the vaccine to be very high, and prioritizing. You would like these vaccines to go to where the virus spread and the disease are increasing. So because of that, Nigeria, you can see the numbers are getting down, and we are not experiencing the third phase yet. So they don't take Nigeria as being a priority for down. So that may delay the supply.
The nation just went through the second wave of COVID-19 and has succeeded in containing the virus. No COVID-19 related deaths have been reported in nearly 2 weeks. The vaccination program is at the core of government's plan to stop the spread of the virus.
The first phase implementation is 3 months. That is from the time you take your first jab to the time you take your second jab. That is when the first phase ends. So to 3 months' time, this same cohort will have their second dose heralding the end of the first phase. Arrangements have been put in place, and Nigeria now is on the priority list that the delivery of the second batch should occur. So it would come in such a way that it will not compromise the trend that we have already established now.
The government plans to vaccinate 40% of Nigerians by the end of the year and 70% by the end of 2022. The country is expecting an additional 41 million vaccine doses through the African Union, and health authorities hope there will be no further delays and setbacks in the rollout of the vaccines.
Minister of Communications and Digital Economy Issa Pantami says from Monday, activation of new SIM card registration will restart with mandatory linkage of the national identification number. Pantami says issuance of new SIMs and the restart of other previously suspended activities will resume on the same date, as long as verification is done and the outlets fully adhere to government's guidelines. In December, the country's mobile telecommunications operators had been stopped from selling or registering new SIM cards. The minister says this is in line with the government's desire to consolidate the achievements of the SIM card registration exercise of September 2019.
Coming up, African stories. Uganda hit by UK South African COVID-19 variant. Cases rise. And later, international news. US slams Russia with sanctions over cyber attacks and its infiltration of 2016 US elections.
You are watching ANN.
Hello, mommy.
My son.
Good evening, ma.
How are you?
I'm fine, ma. Yeah, I'm just about to go on stage right now. Wish me luck.
Good luck, my dear. May it be well with you.
Man.
I pray your show goes very well.
Man, mommy, before I forget, have you linked your NIN to your MTN line? Because I always have to keep reminding you, mommy, and I cannot risk not having your prayers.
But I don't know how to do it.
Mommy, it's as simple as saying MTN. All you need to do is dial *785 your NIN # with your MTN line. Simple.
Staying connected to family, friends, and colleagues has never been easier. Link your NIN to your MTN line now.
Hello, mommy.
My son, I have done it. It is very easy, just like you said.
You see, mommy, I told you.
Welcome back. This is ANN News. Johnson & Johnson and AstraZeneca vaccines with their concomitant problems have raised a concern in Africa. Director of the African Center for Disease Control and Prevention, John Nkengasong, says the center is closely monitoring those events, especially around the Johnson & Johnson vaccine, to ensure safety of all Africans. Correspondent Girum Chala has the story.
Dr. John Nkengasong, thank you so much on behalf of CGTN. An incident has been heard from the United States about the Johnson & Johnson vaccination, and after a few people were reported dead and blood clottings have been heard after they took the J&J vaccinations, the US CDC and the US FDA have temporarily paused the use of this vaccination. Now, Africa, more specifically in South Africa, this Johnson & Johnson vaccination is being used. But what are you really reacting on the news?
We heard the news of the temporary pause for the use of the Johnson & Johnson vaccine in the United States. And this was realized after about 6.6 million people have been vaccinated. And out of the 6.6 million, 6 people developed a blood clotting. So the FDA and the United States Centers for Disease Control and Prevention thought that because of cautionary measures, they had to suspend this and investigate it further. If you look at the events, that is the 6 out of 6.6 million vaccinations, it is really some rare events happening, which would normally perhaps happen in normal settings there. So I think that is a recognition of that. The second thing we need to recognize is that it is a positive thing that the FDA and the United CDC, because of the surveillance systems that they have put in place to monitor people that have been taking these vaccines, we're able to detect this extremely limited few number of people there. So I just want this to be very clear that it speaks to the fact that when we say in public health that we have systems that are monitoring people that have received vaccines, it is actually monitoring them. So that is a positive thing that has happened. Now, we'll wait in the coming days to see what the detailed analysis from the CDC and FDA will tell us, and that will determine the path forward. Maybe, and just maybe, in the coming days, they will say, we've looked at these events, they're extremely rare, and we provide recommendations that this vaccination should continue.
What is the recommendation in general terms from the Africa CDC side for the entire continent when it comes to the usage of this vaccination?
This is a rare event that we are looking at this situation carefully, and we will provide definitive guidance once we know more about it.
Ugandan health authorities are bracing up for rising COVID-19 cases as the nation is hit by the UK and South Africa coronavirus variant. The government says it will be tough on its policies on COVID-19 vaccines and on any private organization that applies to import them. UBC correspondent Andriana Kote reports.
The Ministry of Health is in another turbulent wave of panic now that new data entries indicates a surge in new positive COVID-19 cases since last week. Minister of State in charge of primary health care, Joyce Moriku, says this is signaling the second wave of the pandemic.
Uganda has entered into phase 2 of the coronavirus. We are seeing cases going up from last week. Cases are climbing up. Our graph is no longer going to be flattened. Our graph is gradually rising and rising and rising.
What is more worrying, variants from other countries like South Africa and United Kingdom have been detected in Uganda.
The variant that is from South Africa, the variant that is from United Kingdom is already in Uganda. And this type of variants, they really spread like a bushfire, and they're very aggressive. So that is why we need to take a lot of precaution. As a country, we've put a strong surveillance system in place.
The public has therefore been encouraged to strictly observe COVID-19 preventive measures alongside the ongoing vaccination exercise.
In doing all this, we are still advised to socially keep distance, keep your face mask every time, and hand hygiene, because we are not yet over.
As government prepares for other tough measures, not excluding partial lockdowns in some regions if necessary, government has dismissed reports that it has not permitted private hospitals to procure COVID-19 vaccines for sale.
The message is clear and loud. Any private sector that will wish to import COVID vaccines has to apply to the Director General. And it has to be very clear which type of vaccine are you importing, from which company, where are you going to sell it. Otherwise, these vaccines are not to be sold. They are to be given free of charge to the people. So far, we have no private sector that has imported any vaccine. And we are going to be very strict.
In the last 2 months, the country recorded a decline in the number of COVID-19 cases, but since last week, a rise has been recorded. Adiana Kote, UBC.
When we return, international news. U.S. slams Russia with sanctions over cyber attacks and its infiltration of 2016 U.S. elections. And later, sport. Ministry of Sports says no COVID-19 case was recorded at the sports festival.
You are watching ANN. Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. The United States has slapped Russia with sanctions for its alleged cybercrimes and interference with the country's presidential elections. Addressing the issue on Thursday, President Joe Biden says the United States cannot allow a foreign power to intervene with impunity in the country's elections. 32 entities and individuals linked to Moscow are being sanctioned for disinformation efforts and interference in the 2020 U.S. presidential election. The White House announced 10 personnel from Russia's diplomatic mission in Washington were expelled, including representatives of Russian intelligence services. The Russian Foreign Ministry says the new sanctions are a serious blow to bilateral relations and that Moscow will soon respond to them. In a short speech in the White House on Thursday, Biden said a presidential summit between him and Putin could take place this summer somewhere in Europe. He said the two countries could discuss at that summit arms control and security cooperation and address issues of nuclear threats from Iran and North Korea. He said the coronavirus pandemic and the existential crisis of climate change could also be addressed. The Biden administration had already sanctioned 7 Russian officials and more than a dozen government entities last month in response to Russia's treatment of opposition leader Alexei Navalny. Japan's plan to dump radioactive wastewater into the sea is getting international reactions. On Thursday, the Philippines called on Japan to comply with international law on the protection of the environment. Philippine presidential spokesman Harry Roque says in a virtual press briefing on Thursday that if Japan goes ahead with the decision, international law will catch up with the country.
Well, I can only repeat the principles of international environmental law that I hope all countries will comply with. First principle is that we are one ecosystem. Second principle is that we are interconnected. And the third principle is that the polluter must pay.
Japanese Prime Minister Yoshihide Suga said on Tuesday his government has decided to discharge contaminated radioactive wastewater in Fukushima Prefecture into the sea despite domestic and international opposition. Meanwhile, China has also spoken out on the issue, saying it will make efforts to assess the related products to ensure China's consumer safety. Spokesman at the Chinese Ministry of Commerce, Gao Feng, charged Japan of unilaterally deciding to dump the nuclear wastewater into the ocean without trying all secure treatment means and without conducting full consultations with neighboring countries and the international community. He said China is gravely concerned about what he called Japan's evil doing, which he said may pollute and affect the agricultural and aquatic product. He said China will step up efforts to protect Chinese consumers' health. The COVID-19 pandemic is a global tragedy, but not everyone has been affected in the same way. Brazilian researchers found in a recent study that poverty is one of the factors that puts some people at higher risk of death from the disease. In Sao Paulo, those living in the poorest neighborhoods are 3 times more likely to die of COVID-19 than those in more affluent areas of the city. Correspondent Paulo Cabra reports.
Daverson Valente lost his sister, Janaína Valente, to COVID-19 back in December. Now he comes from time to time with his son to the home where Janaína lived with 2 teenage children in a poor suburb of São Paulo to bring them food, to help them get by in these difficult times of the pandemic and unemployment.
A recent study found COVID-19 unevenly distributed across São Paulo, with the highest death rates in the poor areas, among people with less access to healthcare and living in conditions that make social distancing more difficult too.
We used data of COVID-19 related deaths in 2020 and demonstrated that people are at much higher risk of being killed by the disease if they are black or of mixed race, if they live in neighborhoods with many slums, if they have less formal education, and if they live in households with an average of 5 or more people in the same house.
This does not surprise me. The region where I live is near the Brasilândia slum, and that's where's the highest number of COVID cases in São Paulo. We have to keep on fighting and hope this pandemic will go away. We never thought we would have to live through this. This is destroying the world, and many people still think it's not serious. This is very serious.
Kaique and Breno say after their mother felt the first symptoms, she was afraid of the care she'd be given at the public hospital in their neighborhood.
My mum cried in the hospital and she said she did not want to stay there. She told our oldest sister who took her to the hospital that she believed she was going to die there.
I didn't believe it would be so serious. I thought it would be just a matter of going to the hospital, taking the meds, and that everything would be okay, as it was in other times when she was sick. That day she was hospitalized, I never thought it would be something as serious as it was.
More than 350,000 people have died from COVID-19 in Brazil. It's become a healthcare tragedy for millions of people in a country coping with social inequalities. where many realize the poorer they are, the more likely they are to feel the pain.
Up next, sport. Ministry of Sports says no COVID-19 case was recorded at the sports festival. Please stay with us.
You are watching ANN.
Whether in your house, at your office, on your phone or online, we are there. We have the facts behind the headlines. We cut to the chase with the news you really need. We cover every angle. We are the bigger, better news network. We are African News Network. ANN. Watch ANN News on MITV from a truly African spirit.
Welcome back. This is ANN News and Sport. The main organizing committee of the Edo 2020 National Sports Festival, in conjunction with the Nigeria Center for Disease Control, says it had made a deliberate effort to ensure there was no spike in the spread of the COVID-19 virus during the festival. Permanent Secretary, Ministry of Youth and Sports Development, Nebelisa Anako, who was also the chairman of the main organizing committee, said the festival was a huge success. He said those participants from 10 states who tested positive for coronavirus at the beginning of the festival were immediately isolated in line with health guidelines. Nigeria's Women's Football League side, Edo Queens, say they are ready to grab a CAF Women's Champions League slot ahead of the NWFL Super 6 tournament on Thursday. The Edo Queens will take on Bayelsa Queens, Delta Queens, Rivers Angels, FC Robo and Sunshine Queens for the two slots to represent Nigeria at the regional qualifiers for the maiden CAF Women's Champions League. The tournament begins this weekend. And that is ANN News this evening. Thank you for joining us. For details on these and other breaking stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatuji. Have a great weekend.